So I'm Annalee Coakley. I'm the physician lead of the Mosaic Refugee Health Clinic here in Calgary, Alberta. And today I'd like to share some information about refugee health. We will talk about the Canadian context for migrants. We will understand pre-departure screening for immigrants and refugees to Canada. We will understand the role of refugee clinics across Canada, and we will review the post-arrival health assessments and screening tests that are recommended for immigrants and refugees, and review some common resettlement issues that impact the lives and health of immigrants and refugees. So who are migrants to Canada? There are two large categories. One is permanent migrants, the other is temporary migrants. Most resettlement agencies are concerned with supporting the resettlement of permanent migrants to Canada. And so what are the different types of permanent migrants to Canada? There are three large categories. By far the largest category are economic immigrants. There are also family class immigrants, and there are refugees and other humanitarian migrants destined for Canada. Where do these migrants come from? Usually the top source countries, which are listed here in the slide, but the biggest source countries are places like Philippines, India, and China. In terms of refugee resettlement in Canada, there are several classes of refugees. So there's two broad categories. One is convention refugees, and those are refugees who are coming to Canada as permanent residents. And then the other large category are refugee claimants. And those are people who have come directly to Canada and are applying through the Immigration Review Board to be accepted as a refugee and be ultimately granted permanent residency. In terms of convention refugees, they are resettled in Canada either through government sponsorship, private sponsorship, or a blended visa office referral called a BVOR. Which refugees are prioritized to Canada? So the Canadian government prioritizes women and girls at risk, survivors of violence and torture, those in need of family reunification, those with high medical needs, and children at risk. And so in terms of the health of immigrants and refugees, refugees tend to face numerous health challenges because of their life's journey. So they've usually had to leave their home country, escape to a host country. Their journey has usually been treacherous, and they usually live in poor living conditions in the host country. Because of that, they are at risk of various infectious disease because their access to health care is fairly limited in the host country. They often suffer with neglected chronic disease. And because they've been forced to flee for reasons of persecution, they've often faced violence and sometimes torture. And of course, that sets them up for having challenges with their mental health. Whereas economic immigrants and family class immigrants, they've had to meet certain criteria outlined by the federal government to be able to immigrate to Canada. And so through that point system, one criteria is health. And so for immigrants, they are prevented from coming to Canada if they are unhealthy. So if the government deems that they would place an undue burden on the health system, they're excluded from coming to Canada. And so immigrants tend to be much healthier than the Canadian population. And of course, this is due to numerous factors, but one of the largest contributing factors is the fact that the Canadian government screens out immigrants who are unhealthy, whereas that does not apply to refugees, where their resettlement is part of our international humanitarian obligations. And in fact, those with high medical needs are prioritized for resettlement in Canada. The federal government requires pre-migration health assessments on all permanent residents coming to Canada. So whether it's economic immigrant, family class immigrant, or refugee. What does this immigration medical consist of? It consists of a medical history and a physical exam and certain screening tests. And the screening tests that are required by the federal government for all immigrants destined to, and refugees destined for Canada. So that's a chest x-ray in those 11 years old or older to screen for active pulmonary tuberculosis, HIV test in people who are 15 years of age and older, syphilis in those who are 15 years and older, a urinalysis test in people who are over the age of 5 years, and immigrants undergo a slightly more robust screening because the federal government is trying to screen out people who are unhealthy. But this is all that refugees certainly undergo prior to their arrival in Canada. And so given that they have faced numerous challenges and they are at higher risk of various infectious diseases and neglected chronic diseases, this screening is not adequate. So unlike our American neighbors, Canada doesn't treat refugees empirically with antiparasitics prior to departure or provide comprehensive vaccination. And so most recently, however, Canada has started to offer certain refugee populations in certain parts of the world updated routine vaccinations, including hepatitis B, but that's not consistent for all refugees. There's a bit of a gap in care. So in terms of the testing that the federal government requires, there is a lot that is missed. So the federal government is prioritizing refugees who have been survivors of violence and who have high medical needs, but they're only screening for very few illnesses. And so there's a large gap in the care that they're provided pre-departure. And so following their departure, once they arrive in Canada, oftentimes refugees and refugee receiving cities will be connected to healthcare. And so in the refugee receiving city, the health provider will do a much more comprehensive health assessment. And I find here at the refugee clinic, many of my refugee patients, when they first come, they ask me, you know, why do we need all these tests? I've been thoroughly tested abroad, where that is actually not the case. And so I go through with my patients all the screening tests that they are eligible for and in fact need here in Canada. And so no immigrant or refugee is actually required to have a health assessment, but over the years, the gap in care for refugees has become apparent to the receiving resettlement agencies. And then over the years, refugee clinics have been developed in every refugee, or almost every refugee receiving city across Canada. So, as the physician lead of the Mosaic Refugee Health Clinic, I'm often asked, why is there a need for a specialized refugee clinic? Why do refugees get this special service? And the reason why refugees need a specialized service is because they face numerous health challenges upon their arrival in Canada, and they face numerous barriers in accessing care. So because of their lives' trajectory, they've often had interruptions in their school. They've never planned to come to Canada, so often they don't have the English language skills that they need. So because of their interruptions in their education, they've also had limited opportunities for employment and skills training. And oftentimes refugees have lived in places like refugee camps or in rural areas where they've never learned how to navigate an urban environment. Moreover, many of our refugees have dealt with a completely different health system. So often in their pre-departure country or their home country, if they had a health issue, they would simply go to the local health center and have it dealt with. The whole system of having primary care and specialty care, outpatient clinics, inpatient services, the system here in Canada is very confusing and complex. And it's often a challenge for Canadian-born people to navigate, let alone if you're from a different country with a different system with limited English language skills. So because of those barriers that people face in accessing care, plus because they are at much higher risk of various health issues like infectious disease, like mental health challenges, like PTSD, because children at risk are prioritized, and therefore often it's children with disabilities who are prioritized, and those children have multiple health needs. Because of their health complexity, as well as the challenges they face in accessing care, one-stop shopping at a refugee health clinic to help patients overcome those barriers while they learn the system and to address those health needs in an outpatient setting, these clinics have developed across Canada. And so here at the Mosaic Refugee Health Clinic, we see refugees for their first 2 years to both address their health concerns and help them overcome some of these barriers while they learn the necessary skills to navigate this complex medical and social system, as well as the urban environment. And while they learn some English language skills so that they can eventually become independent navigators of the city, the systems. And so I know a lot of my colleagues and a lot of my patients themselves are confused about health coverage. What are refugees covered for? I know that I often have rejected referrals because in the referral it'll say that the patient is a refugee, and the consultant assumes that refugees don't have coverage. And so this is a mistake. So in terms of coverage, all refugees have health coverage. So convention refugees are coming to Canada as permanent residents. So that's government-sponsored refugees, privately sponsored refugees, and the blended visa office referral refugees. They're coming as permanent residents, and therefore they're eligible for a provincial health number. And so typically within the first few weeks, they receive that provincial health number, which provides them the services the same as any other Albertan or any other permanent resident or citizen of Canada. Even in those first few weeks, while they're waiting for their provincial health number, they also have coverage for health services under a program called Interim Federal Health. And so Interim Federal Health is not the provincial insurance system, but that's the federal insurance. And that is managed by Medavie Blue Cross. And so even if you as a physician are seeing, or a health provider are seeing a patient who is a refugee and they don't yet have their provincial health number, they do have coverage through the interim federal health program. Moreover, that interim federal health program provides them for coverage for 1 year for medications, for optometry services, and for some basic dental services. It's essentially the equivalent of provincial welfare. In Alberta, it's the equivalent of Alberta Works. And so not only do they have health services, but they do have insurance through interim federal health for 1 year for medication, for optical, and for dental services. What if the refugee is not a convention refugee, but a refugee claimant? Do they have access to services and other benefits? And the answer is they do. And so refugee claimants, while they're waiting for their hearing, they have coverage for health services and also for medication, optical, and basic dental through the interim federal health program. And so I think a lot of the confusion has stemmed from way back in 2012 when refugee health was cut by the federal government, and that left many of our refugee claimants without coverage for health services. But all of this was reversed in 2016. And so all refugee claimants have access to health services, medication, dental, and optical through the interim federal health program, which is managed by Madavi Blue Cross. So as we discussed before, refugee clinics have been developed across Canada to meet the needs of refugees. And here in Calgary, we have the Mosaic Refugee Health Clinic, which provides comprehensive primary care to newly arrived refugees for their first 2 years in Canada. And so each refugee clinic across Canada is some variation of the types of services that we offer here. The Mosaic Refugee Health Clinic is amongst one of the sort of largest clinics for refugees in Canada, but most refugee clinics follow a very similar service delivery model. And so here at the Mosaic Refugee Health Clinic, we have family doctors. So generally we have 2 to 4 on every day. All of the family doctors have specialty training in tropical medicine, since many of our refugees come from the tropics. We also have visiting specialists. So again, this is to help reduce those barriers in needing to navigate the city to an outside specialty clinic. And so we have visiting specialists from pediatrics. So we have 2 pediatricians, we have 2 internal medicine specialists, we have a tropical disease specialist, and we have a hepatologist, we have an obstetrician gynecologist. And so all of those specialists come and see our patients in the clinic. In terms of mental health, we have both psychiatrists and psychologists. We also have a very robust interdisciplinary team formed of nurses, many of whom work as complex case managers. We have social workers. We have dietitian, chronic disease nurses, and a very large MOA, which is a medical office assistant staff, simply because patients, when they first arrive in Canada and don't know how to navigate the system and don't know the language, they need help booking various tests like labs and diagnostic imaging tests and their optometry and dental appointments, and they need people to teach them how to go from their home to the outside service. And so we have a large number of medical office assistants who help with that. We also have a health navigator who helps teach people how to navigate the city and the system. And we have somebody called a transition coordinator. So once patients develop the required skills to be able to navigate the systems independently, then they graduate from our program, and we try to do that within a 2-year period, and we connect them to the most appropriate provider. And so we have somebody whose work it is to do just that, to do that assessment. Are they ready for transition? Who is the most appropriate provider? And then they connect the patient to that new provider in their community. And then they follow up periodically to make sure that that relationship is working for the patient. We also work very closely with community partners. Of course, our biggest partner is the Refugee Resettlement Agency in Calgary, that's CCIS, and we do have nurses who are co-located in the resettlement center, so that when people first come to Calgary, and right now many of them are doing their quarantine for their first 2 weeks, we do have a nurse on site who can address any acute concerns while they're in the resettlement center. And so what is our goal here at the Refugee Clinic? Well, our goal is to address and manage any acute concerns that new refugees might have. It's also to identify and manage chronic conditions. In addition, we teach people about preventative medicine. So oftentimes preventative medicine, like the need for routine pap smears, it's often a foreign concept to a lot of people. A lot of people in other parts of the world only seek medical attention when they have a problem. So the idea of doing pap smears to screen for cancer or mammograms to screen for cancer, that's often a foreign concept and something that we need to provide education around. Also, over time, we focus on the relationship with the patients so that they feel comfortable disclosing any sort of mental health concern that they might have. So we typically here at the clinic, although it's different at other clinics, we don't routinely, upon our first encounter, screen for mental health conditions. So we usually wait some time to build up trust, to build up that rapport, to allow people to settle and meet some of their basic needs before we engage in exploring mental health issues. But really, we want to create a safe and welcoming environment so that if people really start to suffer with anxiety, worrying too much, feeling scared for no reason, that they feel comfortable talking to us about that. And so here we do try to address those mental health concerns, and we do have the help of a psychologist, and in complex cases, a psychiatrist who can help patients manage those mental health concerns. So on slide 29, you'll see a photo of the recommended screening tests for immigrants and refugees to Canada. And so what are those screening tests that are recommended? So for all refugees, it would be different depending on their source country, but in general, this is a big picture view of what screening tests are required. So a blood count, looking for anemias, for example. So anemia is very common in the refugee population, often because of poor inadequate dietary intake of vitamins and nutrients, oftentimes iron. So iron deficiency anemia is incredibly common. Our patients often come from parts of the world like the Middle East, Africa, Asia, where the thalassemias are very common, as well as sickle cell. And so with checking the blood count, we also do a hemoglobinopathy screen to check for thalassemia, either trait, which would be important in their future when they're considering having children, or thalassemia disease itself, as well as sickle cell. Either trait, which won't impact the individual right now, but is important when they're considering having children. So I know that that sounds like a lot of information, and so you'll see here on slide 36, I have a slide that provides you resources that you can access. So one is the Canadian Collaboration for Immigrant and Refugee Health, and on that website you can just plug in which country people are from, and it will provide you a list of the required health screening and what they're at risk for. So it's super simple for health providers to use that site to get more information on the required screening. The other great resource for children's health is a website called Caring for Kids New to Canada. And so that website has an abundance of information, both health and also social information. So if you're confused about people's coverage or, category of refugee and what coverage they have, or particular health concerns in kids new to Canada, it's all available on that website. And so I encourage all of you to go and look at those two sites. And so here at the clinic, we've actually analyzed over 2,000 patient charts to see, what are some common themes that arise? What are the characteristics of our patients here in clinic? And so some of those characteristics are that they are young. So these are mostly young families who are in their childbearing years. They have children shortly after their arrival in Canada. Here at the clinic, we have over 40 new members, new babies every year. And so, it's incredibly important to put these families on a healthy foundation to set them up for success. So providing that prenatal care, ensuring that all of their social needs as well as their health needs are met. We also tend to have larger families. And so when we looked at our privately sponsored refugees and government sponsored refugees, our privately sponsored refugees, the family size was between 4 and 6, whereas our government sponsored refugees, the family sizes were between 6 and 10. So you can see that those larger families are going to face a lot of challenges finding affordable housing. And so those needs have to be considered when you're working with your refugee families. They also have complex health needs. And so when we looked at what is the average number of health issues for each of our patients, the average number is 5. And so for a young person, because these are all young people, in Canada, it's highly unusual to have people in their late 20s, early 30s with 5 issues on average. Like that doesn't happen in the Canadian-born population, whereas with our refugee population, the average was 5, and then in our top 10% of users of the clinic, the number of diagnoses was 14. That was the average number in the top 10% of our patients who use the clinic most frequently. So on average, patients came to the clinic around 10 times per year. So again, for young people to need the clinic and its services almost every month, that's very different than a Canadian-born population or a typical family practice. The other thing was that mental health is quite prevalent in our refugee population. And so, because of the reason that they're refugees, where they've been persecuted and often suffered violence and torture, and family separation. Many suffered with depression, anxiety, post-traumatic stress disorder. And so again, very important to address the mental health concerns. And again, their ultimate success depends on the integration of health and social services. And so it's incredibly important for the health sector to work collaboratively with the social sector, like resettlement, in order to meet the needs of the refugee population and set them up for success in Canada. As we discussed, and as you're aware, there's a huge number of social needs and resettlement issues that impact their health and well-being. So their intrinsic needs, as we talked about, they tend to be larger families, so housing tends to be a large need. Financial needs, oftentimes refugees have not had the education or employment opportunities that immigrants have had, for example, and so often they struggle to attend school or to find employment. And because of that, they often face challenges with income and poverty. And then along with that, of course, comes food insecurity. And so oftentimes refugees they have income support, either through the government or through their private sponsor for their first year in Canada. So things in the first year are not too bad, but once in their second year where they lose that support and they have to be switched to Alberta Works, or they have to be employed, and usually some what I will call a survival job, a low skills job that doesn't pay very much. Being able to adapt to a life living in poverty in Canada is quite challenging, and people find it very difficult to meet their most basic needs, like their need for food. And then, of course, as we discussed before, they face multiple navigation issues. So because of the language barrier, that places them at a disadvantage in terms of navigating the city and our social systems and our health system, and that creates stress. The ability to navigate our complex urban environment on sea, train, and bus. They often don't have their own means of transportation, and depending on where you're living, certainly in Calgary, where it becomes very cold in the winter and our public transit system is not fantastic, especially when you're trying to get to the children's hospital, for example, that lives off of the main train line, and it usually requires a train and a couple of buses. It's very difficult to navigate to the children's hospital. And so that's quite a stress for a number of our families. And then just being able to navigate Alberta Works, AISH, Access Calgary, all of it is very challenging. And they often require the help of our social worker and health navigator simply to navigate the system. And then people also are faced with a lot of adaptation issues. So people are confronted with racism just when they're out and about in society, or when they're trying to access care at the hospital, or when they're trying to access social services. Unfortunately, racism is quite prevalent in Canadian society even now. And you hear about it on the news. There was unfortunately a gentleman from an immigrant background who was a nursing student who was killed on a C train platform just because of the color of his skin. And so unfortunately, that's something that they have to learn to cope with, and it provides an incredible amount of stress on top of all of the other issues that they face. And of course, there's sort of this honeymoon period. They have certain expectations coming to Canada. They view it initially as the land of milk and honey. They think all of their problems will be solved. They're coming to this rich country. And then unfortunately, they have to deal with the disappointment and disillusionment of living life in poverty in Canada, which is incredibly difficult. And I loved one of my patients that I accompanied to the hospital once for surgery. One of the nurses was asking him, what does he think of life in Canada? And he said, oh, it's just like the refugee camp, and, it wasn't the answer she was expecting, but that's the lived experience of a refugee coming to Canada. It's not that different than a refugee camp. And then, of course, family separation. So often, because they fled their home country and have been living in very precarious circumstances, and then coming to Canada, they've often left many family members behind. And so, for example, a lot of our Afghans right now, where everything was very chaotic with their exit from Afghanistan, they've left a lot of family members behind. I was talking to one of my patients the other day where she couldn't sleep, etc. And why can't you sleep? Well, she's worried about the son she left behind, who has an end-stage neurological condition, and she's worried he's going to die in Afghanistan alone. And the truth of the matter is, he probably will. And so a lot of the stress of family separation is very common amongst our refugees, and it really creates a lot of distress, and understandably so. And they have very few options to be reunited with their family, especially if their family members are adults. So even if they left a son behind who was, might be an adult son, 21 years old, there's no way to easily reunite that family, and so it's incredibly stressful. And then, of course, adapting to the new culture of Canada. And of course, I think you might see this very commonly in the youth, because oftentimes the youth have a foot in both worlds. So the parents come with certain cultural values and expectations of their children, and the youth are in school and growing up with a lot of people from diverse backgrounds who might have certain values, and maybe some of their behaviors or values come into conflict with the parental values, and it creates a lot of tension within families. And so this is something you might see your children coping with, especially teenagers, as they're trying to assert their independence and become autonomous. Sometimes the life they want to lead and what they want to do with their life and how they want to present themselves in the world comes into conflict with their parental expectations. And so it's a lot for the families, not just upon their resettlement immediately, but also over the long term. I think the synopsis, the take-home message would be immigrants tend to be healthier than refugees for the reasons we talked about. And so refugees often arrive with health needs and barriers in accessing health care. And so this is why specialized refugee health clinics have arisen across Canada in most refugee receiving. And refugees in most refugee receiving jurisdictions are connected to health so that they can have their health needs addressed, and they can undergo more thorough screening so that we can help set them up on a healthy foundation. And so I think it's incumbent upon us all, like both in the health sector and social sector, resettlement sector, to address not only the health needs, but also those social needs So whether it's the intrinsic needs, their need for help with navigation, their need for supports in terms of adapting to life in Canada, because these are young families with long futures ahead of them, it's incumbent upon us all to contribute to setting them up on a healthy foundation so that they can thrive in Canada.